I'm very excited today because we're actually going to be premiering one of the new treatments that we're bringing to NicholsMD. Hopefully in the next week or two you'll hear more about it. But it's basically using PRP, which many of you already know is short for plasma-rich protein, and that comes from our own blood where we get these rich growth factors. And we use it for hair growth, we use it in collagen rejuvenation, for skin and anti-aging. And now we're going to be using it actually to help some patients get a little bit more additional cleavage. Right, so this isn't going to be like a breast augmentation, but it's for people who maybe, want a little bit more cleavage, they want a little bit more fullness in the top to get them, the look that they're looking for. So really it's just using their own growth factors from the PRP to sort of build that volume, build that collagen there. So what the treatment involves is, of course, we take the blood from the patient. We have a patient right here that we're going to be demonstrating on today. And then we spin the blood in the centrifuge for about 15 to 20 minutes. And then out comes what we call liquid gold. So this is our patient's actual plasma. And we get a number of syringes of that out of, taking the blood from her. And we're going to use this to inject in the breast area, in the upper and sort of medial portions, again, trying to get a little bit more cleavage there that she's looking for. So I'm very excited about this new treatment. We're going to be doing it in a series of 3 treatments a month apart. And you can expect to see improvement there over those 3 to 6 months after the treatments. So, and it can last, a year or so. So that's very exciting for people who just want that a little bit additional breast lift. So we're going to get started today. I'm actually going to be doing one side of the patient, and then I'm also going to have Vanesa, our new physician assistant extraordinaire, and she's going to be doing the other side, so you guys get to see both. So we're going to begin marking the patient, and as we have seen from the examination, and she's related to us, this side, her left side, does have a little bit more fullness than the right side. So we're going to be injecting a bit more of the plasma in this side. And we really use our injections, like I said, in that medial and upper portion of the breast. So I like, kind of this little upside down L, sort of. I'm not the best artist, but we see what I'm saying. Okay, so now we're going to begin the injections. I'm actually going to begin on this side, and then Vanesa will do the right side. So we're going to begin the injections now. And really, the patient has already been numbing for about 30 minutes in this area. Not all patients need to numb, but this patient actually wanted to numb. And we're also going to be using the vibrato, which you guys probably know that we use for a lot of injections, and it really helps take any of the edge off of any of the discomfort. So we'll begin. So the patient should expect to feel a little bit of a burning sensation with injection. It's usually not too bad. And we're going to kind of going around this whole area. Everything good?
Mm-hmm.
Good. Okay. And I'm focusing on sort of hitting all these points. And what's nice in terms of looking at progress, even for patients at home, is to, kind of use the same bra and try it on every month, during the treatments and after, to sort of see the progression in terms of the lift and increased cleavage that, she's looking for. So that's really kind of a good way, because sometimes, just pictures won't give it justice. But we will have some after photos to show you guys in a few months of this patient. And now I'm going to move on to that medial sort of cleavage area. And in terms of what to expect afterwards, really it's pretty much of a no downtime type of treatment. You know, the patient might have a little bit of soreness in the area, but again, nothing to really impede any of her activities, so she can go about her business. And then we'll bring her back in about 4 weeks for the second of the 3 of the series. Almost done with this side. And we'll do the rest of it on this side, since again, this one, we're gonna do a little bit less. And so now we're gonna switch providers, and Vanesa's going to do the right side. So what the patient has actually already commented on was, if you see the breast that's already been treated, you know, there's a little bit of redness there from the injection, but she already feels and notices more fullness there. Something to tell the patients though is that's actually really just the effect of the liquid, but the liquid of course will be absorbed and that'll go down, but then the collagen building process begins. But it can at least help to give you an idea of what it eventually will look like, or the aim of that. So. And in terms of why we inject in these particular areas, you know, when you're looking at, you know, getting more cleavage, think of it as you want a little bit more up, so thus the upper portion to get more lift, and then in the medial to bring, you know, more in there. So that's sort of the reasoning behind where we inject. We wouldn't want to inject, you know, at the bottom of the breast, of course, because that would actually give more weight and droop to it. So. Now that we're finishing up, so if you have any questions or interested in this procedure, the PRP Breast Lift, please give us a call, come in for a consultation, be happy to chat with you about it. It's really, you know, kind of a great treatment that's sweeping the country, so I think you're gonna see a lot more of this, you know, around in your social media and such. Thank you.